Good evening. I want to thank you for helping us honor some of the many health heroes in our community this evening. As Martin Luther King Jr. said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. That is why I am proud of my 50-year involvement with this organization that works to provide healthcare services for all citizens who live in Pierce County. Every day, the staff of the community health care helped individuals cope with the effect of systemic racism. Even here in Tacoma, the lifespan of poor minority individuals is years less than their more affluent neighbor, even though they live only a few miles apart. Pregnant African American women die at a higher rate than their white counterparts. The same is true for their children. The board, the management team, and staff recognizes that systemic racism and exclusion exist in the nation as a whole and the healthcare system that's in place. In our clinics, we see the impact racism has on African American communities. Community healthcare stands with Black Lives Matter against racial injustice and inequality. And we believe that systemic racism and exclusion represents a public health crisis that negatively impact the lives and health of communities of color and indigenous populations, of LGBTQIA plus people, of women, of immigrants, and other marginalized populations. Diversity, equity, and inclusion are cornerstone principles that guide community healthcare in its mission, vision, values, and utmost overarching goals, and to provide the highest quality healthcare with compassion and accessible services to all. The Board of Directors, the management team, and staff ask everyone to join them in taking steps to identify and dismantle systemic racism in the community, to review their attitudes about race and microaggressions, and to fully recognize the promise and the moral imperative contained in the principles of diversity, equity, and inclusion. Thank you.